Hello, my name is Jessica Duis. I'm the director of the Angelman Syndrome Clinic at Children's Hospital Colorado, and I'm very happy to be with you today to be talking about adult care for Angelman syndrome. So, today I'm going to be talking about transition and access to care, routine and activities, nutrition, behavior, sleep, and gait and mobility. So, when you're starting to think about transition of care as your loved one gets older, we always think first about transition programs. And in the state of Colorado, individuals can go to school usually through the age of 21 and participate in transition programs. And these are programs where they focus on independence, vocational skills. That is something that often individuals with Angelman very much enjoy going out into the community and can also be a trigger for you to start thinking about what does the future look like. This can provide some prolonged routine and access to school services. We always recommend continuing, if you have a paraprofessional, for example, continuing that type of support so that the transition is smoother for the individual with Angelman syndrome. It's also a good time to start thinking about guardianship. Usually, this occurs at the age of 18. And when you start having conversations about transition programs, it's certainly important to make sure that you've thought about this and that you've started the process for guardianship, thinking about trusts, which often come a little bit earlier than this. We also really emphasize the importance of respite and day programs as your loved one gets older. This really can be supportive to ensure that there's some routine, but also that there's some varying caretakers in your adult's life. Individuals with Angelman, as I'll talk about in a little bit, have a high risk of anxiety, particularly around separation from the caretaker. And so, if you can get many caretakers involved from an early time, then that makes this transition a little bit easier. And then, of course, long term care planning, talking early on with siblings or planning ahead for what happens with your loved one when you're no longer around. So there's lots of resources for this. I didn't make many slides because I think these resources are wonderful and available to you online at your convenience. But the ARC can be a wonderful resource to help you plan for the future. In addition, Sam Sid Stick Together has a great webinar available to talk about transition to adulthood as well. One of the things that we've been seeing in our clinic as well has been some nutritional changes for your loved one as they get older. We're often seeing actually a presentation of something called failure to thrive, where the individual with Angelman has significant weight loss as they get older and into adulthood. It's kind of unclear what the cause of this is. I think that there are many things, including transitions, challenges of feeling like they haven't gained independence and wanting to have that independence can be challenging. Also, we've seen swallow concerns emerge, and this may be related to number five, reflux, where things are coming back up and they're swallowing them back down. But definitely keeping an eye on swallow as they get older can be really important. And we have had some individuals who actually we have found on swallow studies that they do have aspiration or the food's going down the wrong way, and we have had to thicken fluids, for example, to try to avoid those complications. A lot of times they become more picky, and we've had this come up in many individuals with Angelman. So just continuing to push variety, drinking water is really important as well. And gagging behaviors can come up actually earlier than adulthood, but become worse in adulthood. We've seen a lot of patients actually in the community, if they're out and they smell something or they're in an environment where it's very overstimulating, they can develop these gagging behaviors, which can often be actually related more to behavior as opposed to nutrition itself. And then reflux can certainly be an issue where they're starting to feel that heartburn and they're starting to feel things come up, and it causes almost an aversion to eating. So, really, really important when you see these issues to address them, to discuss them with families. And, if you're seeing this, discuss it with your your providers. A lot of times we've seen severe constipation. Even if the individual is going to the bathroom regularly, we can find that they're very backed up. And reflux can also be a trigger, as I mentioned, in terms of changes in nutrition. We also have seen some depression or recent transitions, especially if it's a time when they've transitioned out of school and out of a transition program with less structured activities. This can cause some depression, and something to definitely be aware of. Like I said, ruling out aspiration, getting a swallow study, and working with a feeding therapist. And even if it's in adulthood, you should be able to find a feeding therapist who at least will work with you for a period of time to help think about what some of the causes may be, and how to work around those feeding challenges. Nutritional supplements are something that we have implemented in adults many times. We like a supplement called Kate Farms, but there's many out there where Boost, it depends kind of on flavors and what the individual likes. But I think trialing nutritional supplements, even if you just use them if it's a bad day and they're not eating well, can help maintain weight and prevent significant failure to thrive and weight loss. And then these are individuals that should be seen in clinic really frequently. I'll transition them to see me alone outside of the multidisciplinary clinic for several visits so that I can follow really closely. And then I can't emphasize enough that you should ask your physician to check nutritional labs. And what that can be is iron. We often check an inflammatory marker with the iron, vitamin D, all the electrolytes, liver function. Albumin is on that same comprehensive metabolic panel that we recommend. Complete blood counts, really getting a comprehensive lab review and making sure that we're not missing anything. Sometimes nutritional changes can also be related to medications. So, if there is a nutritional change, going through the medications with your provider and looking them up yourself to make sure that they couldn't be necessarily contributing to nutritional changes. Depakote is a big player here, and a lot of times we have adults who have been on Depakote for many years and then have this decline that includes this failure to thrive, and it can be related to Depakote, so something just to be aware of. So transitioning to behavior, so this was a paper that was published by Ann Wheeler's group, just looking at the comprehensive review of all the different behaviors we see, and this wasn't specific to adults, but you can see that anxiety is really high. And so this is something that we see really manifest a lot in adults as transitions are happening. And some of the things that we've identified in adults can be something called cognitive rigidity, where they have insistence on this routine. And sometimes that routine includes a very preferred caretaker that they always want to be attached to. Um, and that can be very challenging, both for the caregiver, but also for the individual with Angelman. We also have a lot of patients that develop this flight or fight response that can be quite aggressive. And it's oftentimes when they feel threatened, like the caretaker maybe, transitioning out of the picture, maybe respite care comes in, and we can see this really significant aggression, which can also be self-injurious. And it's really striking, wherein we can see, this, you can see the panic in the individual, and we know it's uncomfortable for them, and it can manifest many different ways. Aggression can escalate in adulthood. It can in part be related to communication and challenges that continue with communication. And it's never too late to really work on implementation of an augmentative and assistive communication device. And then a lot of this is driven by anxiety, but the challenge is sometimes there's these deep seated beliefs about something that might be related to the caretaker. And sometimes the medications we might think about for anxiety can make the aggression worse. And so you really want to be thoughtful about making sure you're treating the anxiety, but also thinking about what is driving some of the anxiety and the impulsive behavior. And sometimes we need special medications that target that impulsiveness before we really focus on the anxiety. So, coming to treatment consideration. So, if there is a change in behavior, you really want to rule out triggers. Severe constipation, I can't emphasize enough, is a big trigger in adults for many of the things that we're talking about: behavior, sleep difficulties, even something called non-epileptic myoclonus, which I know others will be talking about, but it can be really debilitating. And if you treat the underlying cause, it can really make a huge difference. So pain sometimes is coming from flexion contractures, which is an inability for it causes an inability for the adult with Angelman to fully open their leg, for example, or put their feet flat on the floor, which can be incredibly painful. And then teeth. I can't emphasize enough the importance of making sure that there's regular dental care, because we have seen many individuals with Angelman who develop significant cavities and pain in their gums that can be contributing. Programs and activities are so important. Special Olympics, if it's available in your area, or adaptive sports, working locally to figure out what your resources are can be so important because it maintains that independence. So, going to Special Olympics, they'll interact with other people, other adults as well. And so that really gives them an outlet and a space to separate and do something they enjoy. And if you make it a routine for them, it can be something that's an incredible strength to have available to them. You really want to work with therapies, and getting insurance to cover therapies in adults can be challenging, but if you're working towards a specific goal, even if it's short lived, 8 weeks, 10 weeks, if you have those specific goals, we often can get it covered. And maximizing independence, we see a lot of families where individuals with Angelman really have so many people taking care of them and who love them, but often help them and intervene and don't give that opportunity for independence. And so I think working, for example, with occupational therapy on ways to have feeding independence and independence with activities of daily living can be really helpful. Respite, like I said, introducing other caregivers early on so that they get used to other people can actually be a huge strength when it comes to anxiety, being away from a caretaker. Behavioral therapy can be really challenging to get for adults. But that said, it can be really helpful, particularly if you're working towards goals around a specific behavior. And the other thing is to have a safe space for the individual to go. So, a safe sleep bed. It's never too late for a safe sleep bed for an individual with Angelman syndrome, because it gives them some independence, even if they're waking up at night. But also, if they're stressed, it can be a place where they have safe space where they can go and they can calm down. And you can create that expectations by working with them on that being their go-to space. And then this often needs to start early on, but a lot of behaviors in adults are very attention seeking. This is true in kids too, but we see all the time in clinic adults waiting to see what the boundary is and when we're going to get frustrated or respond to them. And so you want to really do it when there's good behaviors, or when you're rewarding them for the behavior that you desire from them. I can think of a good example where we had actually an individual with Angelman who was temporarily in a wheelchair because she had hurt her foot. And our dietitian was sitting behind her in the wheelchair, and she navigated the wheelchair beautifully, moving back and forth, but was waiting to get a rise out of the our dietitian. And thought that was a lot of fun. And she didn't mean it maliciously. She was just playing. But, the more that you give into those behaviors, saying ow and, giving negative attention, the more that they will do them. So Medications often are needed for behaviors. I think we usually would want to start, on some of the other things that I just mentioned. But, there is some medical literature about a medication called buspirone that can be helpful for generalized anxiety. We use a lot of clonidine or guanfacine. And then, as I mentioned, those antipsychotics that would treat really, truly impulsive behaviors, such as Risperdal, can be really helpful. And this is an algorithm actually that we published as in our standard of care paper that goes through an approach for different common behaviors in Angelman, hyperactivity, aggression, and repetitive behaviors. And this is still very relevant for adults. And I think a good place to kind of good thing to use as a resource and consider and taking to your doctors. Sleep challenges remain in adulthood. I would say it's even more important if there's a change in sleep for an adult that you really consider medical concerns, GI issues, reflux is a big one, teeth pain, changes in, environment that could be driving anxiety, mental health concerns that are contributing to sleep. But this is another kind of tiered approach to difficulty falling asleep, nighttime wakenings, and restless sleep. We often see nighttime wakenings being the biggest challenge in individuals with Angelman syndrome in general and adults as well. The other thing I would say is it's never too late to get that safe sleep bed. We find that adults find them very comforting. And so we still recommend those and help families get those even for adults. So the other thing that I just wanted to touch on is gait and mobility. And one of the things that we observed about 10 years ago is that there is definitely a change in a good number of individuals as they get older and enter adulthood, where they develop this pattern of walking where it's called a flex, we're calling it a flex knee gait pattern, where you can see that they can't fully open up their knee. And so they have this angle here. And when they're walking, it looks like they're walking closer and closer to the ground. And we see this actually in up to 75% of the adults that we see. And it is associated with a decline in their quality of life, which is why it is so critical to be looking at this and thinking about this from the time that you start to see some of these findings. And, one of the things we observed early on is that individuals who have had Botox, particularly Botox throughout their body and not concentrated in one specific place for a short period of time, do have a significant decline in their mobility because the, when you're walking like this, strength in your quads is what really keeps you upright. And if you inject, the muscles of the leg, what happens is that actually you cause weakness and it can make this worse. So you really want to be cognizant of um, you know, going to someone who has some background knowledge of this in Angelman syndrome and being thoughtful about how you treat it. And one of the reasons I bring this is a little bit younger than adults, but we see that there's this period of time where kids do their best. And then there's this decline, and unfortunately, as individuals get older, we continue to kind of see this decline. So it affects how fast they're walking, and oftentimes you'll see individuals with Angelman as they get older and as adults take really short, fast-paced steps to try to keep up their velocity and cadence. And over time, what happens is it's difficult to continue to maintain that. So we see a lot of adults who end up in adaptive strollers or wheelchairs, especially if they're going to go for long walks, like they're going to go out in the community to the zoo for the day, that they need to often have supports there and equipment. And this is just to say that spasticity is not associated with Angelman syndrome. What this means is that this is not neurologically mediated. And I emphasize this so much because when we go to do Botox, we do think that it makes it worse. And this just goes over, it's a little bit too much detail probably, but goes over that what the cause of this looks like is that there's an inability to fully open up the knee here, and also an inability to fully extend the hip or move the leg at the hip. And so that's what's causing this. So, in terms of treatment, what are we thinking about when we think about this cause of the changes in walking that we see in Angelman? And we're thinking more along the lines of braces, orthotics, making sure that there's support with orthotics. And then we're also talking about sometimes for very brief periods of time, you have to be so careful. And again, you have to go to someone who's familiar with Angelman, and really, even someone who's familiar with cerebral palsy might be helpful, where we want to, maybe use a brace or cast to try to open up the contracture or that limited amount of movement that can occur, but you don't want to leave it on for too long because it can also cause weakness. Um, the other thing I will just add is that scoliosis is a big issue in adults. I'm not going to go into detail about it, but sometimes if it gets to the point where scoliosis surgery is needed, sometimes repair of the scoliosis will actually improve the walking. So, we continue learning about Angelman, and this is what's the beauty of our learning network, but also of our amazing multidisciplinary team that we have. And, you know, I just want to highlight a few things about adults here that I think are so incredibly important. One of them is that individuals with Angelman keep learning. So, what we're seeing is that they continue to pick up skills and continue to show skills as they get older. Um, and, I emphasize that integration of an AAC device for communication can actually help a lot of these issues, because sometimes, for example, the behavior challenges are related to frustration with communication. So, never too late to integrate opportunities for learning as well as opportunities for different ways of communicating. GI symptoms are really important as individuals get to be adults. And we find that as individuals get older with Angelman, they often have significantly slowed emptying of their gut. The other thing we're seeing a lot of is that you really want to use oral treatments for constipation. And those can be stimulatory agents that also cause some movement of the gut. So we like a plant extract called senna. We often will use magnesium or natural options, but you really, as an adult, need to be on something every single day for constipation, because you have this slowing down of the gut called gastroparesis. Cyclic vomiting, which is quite related to the gagging that I mentioned, that can often be with different smells or new environments or overstimulating environments. And oftentimes, once they start gagging, they can have a lot of serial vomiting that happens. And one of the things that we've considered here is the possibility that actually migraines could be a piece of this. And so, one of the things that we have found that can be helpful are medications that might target multiple causes. For example, might target behavior, might target anxiety, and might target headaches. And so, one of the things we like a lot is something called amitriptyline. Sleep continues to be challenging as individuals get older, and sometimes medications are needed for management of sleep. Motor, we talked a lot about motor challenges, use of orthotic, short periods of casting. Mobility does change over time in many adults. Like I said, we're seeing that up to 75% of adults. So it's incredibly important to talk with your doctors about. And then we didn't talk a lot about it, but non-epileptic myoclonus, as I know Dr. Carson's going to go into detail about, really can be very debilitating. We've seen individuals where they're triggered by transfers, where they're triggered by constipation. So the only thing that I can really, really emphasize is that you really want to leave no stone unturned in terms of thinking about what are some of the triggers. And then medications can be helpful. But really, for us, it's been identifying what are some of the causes. Could it be teeth pain? Could it be pain with transitions? in terms of transition from a chair to bed, transition to standing. Some of those things seem to be triggers and are important to keep in mind. The other thing I did not mention in my slides, but one of the things we see frequently with non-epileptic myoclonus is that periods for girls with Angelman syndrome and hormonal shifts can be a trigger. And so we often, for many reasons, for safety, because cycling periods and cycling hormones can cause seizures to worsen and can impact non-epileptic myoclonus, we often do recommend management of periods. We will do either oral, where we will skip the sugar pills so that they don't get their period for several months and only get it every 4 months or so. We will do Implanon or IUDs, and work very closely with gynecology to manage that. And that it can be really incredibly important for individuals with Angelman. Um, this is a little bit more about just what the muscle firing looks like when we come back to the flex knee gait pattern. There can be these abnormal patterns if we put little sensors on their leg and look at how the muscles are firing. The muscle amplitude, so how high the amplitude goes, can be lower, but they can be triggered muscles for much longer periods of time. Typically, muscles are triggered during these um, black bars, but you can see that there's an extended period of triggering. And that's because that individual needs to have that prolonged triggering to remain upright, because of the contractures that we talked about. So I want to leave you with some really important resources. One of the things I was incredibly thrilled to be a part of was putting together a multidisciplinary approach and standard of care for Angelman. And the algorithms that I showed today are within that paper. This is a free resource that anyone can access online. Take it to your physicians and your care providers and anyone your child interacts with in the community. There's supplemental figures for therapists to help you. There's amazing resources on the Angelman Syndrome Foundation website. And then I just wanted to mention something that I'm also incredibly proud to be involved in, something called Rare Sibling Stories, which is a series of books as well as social media outlet where we're really, targeting creating an environment where siblings with many different rare disorders, including Angelman syndrome, can interact and discuss their experiences and have support from one another. And so that is a great resource for siblings. And then, at Children's Hospital Colorado, we are lucky to be funded by the Angelman Syndrome Foundation to offer consultations, to send data back to your providers. And we offer this for adults. And I can't emphasize enough, if there's anything we can do to help support you, we would love to. We also do see adults in our clinic, but really what we want is to help empower you and your local providers to make sure that your adult is getting the best care possible. So we're super thankful to the Angelman Syndrome Foundation for supporting us to do that. And with that, I'll say have a good day. And if there's anything we can ever do for you, we're here and we want to support this community as much as we possibly can. So thank you so much for having me.